everyone. My name is Tepion Penge. I'm currently a third-year social work student. We are under the Department of Social Work and Sociology at Kwame Nkrumah University of Science and Technology.
For today's discussion, we're going to be talking about abortion, whether it is good, whether it is bad, the legalities, the implications of it with the law as well as with the health of the individuals. So we have our panel here, and we'll be talking about it. For most people, they believe that abortions should be legalized, and this is so that women have full control over their reproductive rights. As many women have argued, they should have the final say in whether abortions are legal or not. Now, many people also believe that abortions should not be legalized because it goes against the natural order of things as well as human rights. Many people have argued that these infants who are aborted are also human beings and therefore have a right to life. So today we'll be engaging you to see what each and every one of you thinks about the topic of abortion. Now, because we don't want to jump into technicalities, we'll start with our social workers so that we can get your thoughts on it. Then finally we move to our health professional and our learned lawyer. So to start up our discussions, my brother Samson, would you mind telling us what you think about it? Do you think it should be legalized? Do you think it's good? What is your thoughts on abortion?
Okay, for me, I think it should not be legalized.
It should not be legalized.
Because everyone has a dignity.
Okay.
So if someone has a dignity, the person needs to be treated with ultimate value and words. So if we are to respect someone's rights, we have to appreciate the person, even though if the person is not yet born. You can't say that the fact that you feel that you don't have the capacity to take care of the child, that give you the right to maybe terminate their life. It's not. I don't think that's right, because everybody has ultimate dignity and ultimate rights as a human being. That's what I think.
All right, thank you so much. So you believe that all life is sacred, and for that reason, the child should be allowed to come into the world, and that life should not be taken from them. Yes, please. That's a wonderful view. So, Misters, what do you also think about abortion? Do you think it's good? Do you think it's bad? Share with us.
When it comes to abortion, it's really a very difficult choice to the person who wants to do the abortion. I feel like everyone has that right of living. Yeah, we do not refuse. Let's take, for instance, a 12-year girl who has maybe has been raped, and because by that time the girl is already menstruating, and we cannot put the life of the child in danger, and we have to see what is best for the child. We cannot let a child of like a 12-year girl to take care of, to carry a pregnancy at a young age. So I think at that stage when it comes to rape and someone really, because there are very many people when they are raped and they remember that they are pregnant, they really get traumatized, because if they give birth to that child is going to be subject to a lot of also trauma. It's like the mother is going to be remembering whatever happened to her is going to put on the child is going to be abused, the child won't be having peace, the child is likely to be neglected. So in terms of maybe when someone has been raped and the person has come forward to say that I really want to terminate this pregnancy, because keeping it to be like double trauma, you think about the pregnancy, you think about how you were raped, and you will live with the effect, like the outcome of the rape, that is a child. So in order maybe to keep someone out of a long time trauma, like maybe the person was raped, I would gladly respect the person's choice to do their abortion.
All right, thank you so much. So, if we're getting what you're saying right, you believe that it should be legalized, right? Because of certain conditions that might be underlying factors. All right, thank you so much, Ms. Mercy. What would you also share with us?
Oh, okay. As for me, when it comes to abortion, I would say abortion is good with the condition that, let's say the mother is not in good health, and if we keep that child, it will destroy the mother's health. In that state, we should allow the abortion like to come. But here is another instance where the person willingly go and have intimacy with someone, and they got pregnant willingly, and there are no complications. In that case, I think the law should put some sanction, because like the child is the right
Yes.
to. So I think the law should put some sanction on that, because if you truly know that I don't want to get pregnant, I don't want to take care of that child, you should take some responsibility, use protection, so that we won't get pregnant.
Yes.
So I only agree to abortion when it has implications on the mother, or else the child we are expecting, maybe it will come and the child will be disabled, and the
Yeah.
child will, let's say, some way.
Yes.
In that case, I'll agree to abortion.
Alright. Thank you so much. Thank you so much. Yes, please.
Okay, for me, when we say abortion, abortion is when you are ending a pregnancy before it becomes a live birth. For me, I object to abortion, but I rather subject to it when it's based on certain conditions, especially when it's based on medical conditions. When you read the Constitution says that everyone has the right to life.
Yes.
That means that under no circumstance should the life of a person be taken. So, and then it's the responsibility of the state, as far as the child is being born, it's the responsibility of the state to take care of the child. So if I'm a mother and then I get pregnant, whether really or unwillingly, it's my responsibility to give birth. Because when I give birth, it's the state who will take care of the child, including me, the mother. So me, I object to we mothers taking the life of our wombs, babies in our wombs. Yeah.
Unless there is a health condition.
Yeah.
Alright. Thank
Maybe
you.
you not aborting the child is going to have an implication. Maybe it's going to cause you to lose your life, or it's going to cause an injury to you, the mother. For that one, you can abort the baby. But if there is no medical conditions that it will affect you negatively, I don't think it's right for the mother to abort the baby.
Alright. Thank you so much. As I mentioned earlier, we've heard from our social workers, but we have our learned lawyer and our healthcare practitioner or students currently with us. But I would like to start with our learned lawyer friend. So the Constitution of Ghana, it says the Criminal Offence Act of 1960, Article 29 says that there are legal grounds for abortion, and you can perform these abortions in a certified hospital or clinic, right? It also says that the abortion is permitted with conditions, and these conditions include rape, incest, defilement, and high health risk, as already mentioned, and fatal abnormality. Now, looking at this, do you think that abortion is right, and do you think the Ghanaian Constitution is on the right path when it comes to matters of abortion?
I'm the standpoint that abortion should be legalized. And I'm more of like a positive law thinker. I follow the law as it is. And under the Criminal Offences Act 29 and Section 58, it has listed the exceptions for abortion. Yes, I do agree that it should be legalized, but I also have my exceptions. That is, if you, the person, you consented to the sexual intercourse, then you get pregnant. I feel of that standpoint here, you shouldn't take an abortion because you knew the risk you were taking when you were having the sexual intercourse. And also the reason why I believe it should be legalized is also based on the exceptions that have been listed in Section 29 and also in Section 58 of the Act 29 of Ghana, which says the fetal complications, and other stuff right now. And apart from that, I don't think I have anything.
All right. Thank you so much. Thank you for your additional spice to the constitution. So, if given the chance to amend, would you add these other conditions to the amendment in the constitution currently, saying if you consented to it and there are no health implications, you should not be allowed to do it? Would you add that to the constitution?
Yes, I would strongly add that because I feel like you consented to do this to yourself. So
Yes.
at the end of the day, you know the risks. And then if you end up getting pregnant and there are no complications, you shouldn't be surprised at the end of the day, at the end of the day that you are pregnant. And I feel like it would be really, really wrong for you to take such a step if you know the consequences of
Okay.
going to.
All right. Thank you so much.
I want to ask a question
Yes.
to what you have saying. In case like yes, you went into this, even like that's youth in love, madly in love, goes into that and goes into sex and she gets pregnant. But the person responsible for the pregnancy says, I'm not going to take care of it. And the lady or maybe the family of the child is also not in position to take care of the child because bringing up a child is a lot of responsibility. Or probably the child is also the lady who is pregnant is also still at school. And the family is like, we are not going to help, and that maybe if you drop out of school, you are living here. We are not going to help you. Like, how does legal help you do that? In that situation where the child is in dilemma, I'm pregnant, the person responsible doesn't want the child, the family also doesn't want the child, and the person with the problem also does not have anything to help herself.
So in this manner, I would say, as you were mentioning, like it's the responsibility of the state. And in this case, let's say she cannot take care of herself. I also feel that there should be, provisions for like taking care of such children, like supporting the mother as she's growing, like as she's taking care of the child, so that I know that she may not have, okay, let's say, I want to ask you a question. So maybe in the case that she's madly in love, she has a child, and let's say like she's not having the money to take care of the child and everything, but maybe she's willing to take care of the child, then the state can provide for that. I believe that it should be responsible.
Like currently, the state of Ghana have that component of maybe helping those children who are pregnant in that kind of dilemma. The family doesn't want them, and the person responsible doesn't want them. Why does the state have for now?
For now, there's not really much that has been said or provided for under such circumstances. But from my standpoint, you also asked me if there were any amendments that I would like to add, and maybe that would also be a provision. Even though I do agree that it should be legalized, but there should be provisions for such people who are willing to take care of their child, but they don't have the money to take care of the child, so that abortion
that thing like you are saying that the mother should come to the social welfare department and then they will send the child to foster homes or child care homes. Like my question is, how many foster homes do we have? How many like child care homes do we have that will accommodate these all like way to children?
And when we have accountability, some of them when they come to the office, they are not there to give out their child for us to send them to foster homes. So some of them come to make complaint that the father has refused to take care of the child. So what we social workers have to do is that you give a call and then you inform the father to come to the office, and then the date will be fixed for the father and the mother and plan the child to be in your office, and then at the end of it we are going to make a decision, and the father has to agree to it that he is responsible to take care of the child as far as the child is his.
Okay, but
And
here
then you
is
are
the
going to
case.
face an amount for the father to pay at the end.
No, here is the case like the father is denied the responsibility. He doesn't even want the child.
But the child is his.
Is your question the fact that in a situation where the father denies the child, is it then okay to have an abortion? Is that the question we're driving at?
Yes.
But that the father knows that the child is his.
Yes, but if he
He's
denies,
aware.
He's
yes.
aware, but he's denying the responsibility.
See, I don't think there are any
Okay, I also wanted to ask like a question to the legal team. What's me like? I feel like there should be a punishment for such acts. Like you have implemented someone and you spend family like the person is not like the child in the womb is not mine. And maybe if later the child is born, or maybe as society has advanced, we run a DNA and the child is truly yours. What should be really the punishment for such a person? Like, yes, we know we are going to force them to pay the child maintenance and taking care of the pregnant mom. But I really want to know what is that extra punishment can they be given for receiving, like for refusing their responsibility?
So, when you go into sexual intercourse, it's like you are signing a contract, you make an offer, I accept the offer, and then when you go into a contract, it's like there are risks involved, and I feel that you as a man, you go into your contract, you perform some part of your duty, then you are not willing to take care of the rest. I also feel that there should be provisions for such men, because I have heard recently that I'm not really sure of the speculation that now they are saying that if a man promises to marry
And doesn't you pay 30 something?
yes,
Yeah.
there should be something like that provided for such men who go into sexual intercourse, and then you have willingly entered into a contract. You should pay for your breach. I feel that there should be.
I love where the discussion is going, but we're slowly moving away from abortion into marriage. Our legal team has given us a glimpse into the legal and the legalities of abortion. So let's hear from a healthcare student, soon to be healthcare professional, who would have better things to say about abortion, not just as to whether it is good or it is bad, but on a biological level. What does it do to the individual? What consequences does it have on us? So please, Mr. Alphonse, if you would.
Yeah, thank you for the opportunity. And I've heard also from my colleagues. I think I'm also learning a lot from social work, although it's a very diverse field that we are now in. So I'll talk on it on human rights perspective and also the medical right perspective. Everyone here has a right to life, and even the unborn child has a right to life according to the Ghana laws and the common law that we are working on. But on the medical perspective, to be precise, is that abortion is allowed in the medical perspective, but also guided by the rules that governs Ghana and also the medical field. So maybe to some of the scenarios whereby in medical field we can allow abortion is when someone is having pre-eclampsia. This is a question whereby the the woman is bleeding a lot and may have severe conditions such as seizures, like you are not well mentally, and even heart failure. So if the medical
Thank you so much. Now, through this, or the main question that we are faced with is the factor of the fact that it is a human rights violation. So our last question, and then we wrap up, goes to our money medical fund. So, at what point does, or do we consider the fertilization or the fertilized egg human, so that we know what time periods we are talking about when we're talking about abortion? Is it, say, they had the intercourse and it's been 3 weeks, and they realize, oh, maybe my time of the month has come, but I'm not seeing it. Is it that time? Or is it when it has developed to a certain point? At what point exactly in the inception process can we say that at this point, this has become a human being or has life, so the abortion is bad or is good or goes against human rights?
Okay, maybe before I come on to at what stage or is it dangerous, maybe you can summarize the question. The first thing is that maybe as healthcare professionals, when someone comes, like maybe we talk about the 16-year-old child, we just have to assess if there is anything that, like, if there is anything there that can happen to the girl, maybe after abortion. There are some people that they bleed a lot. It's like they are kind of, it's like it's a kind of condition people have, they bleed a lot. So this can have an effect on the child. For us, we will assess and see, is it good for her to do the abortion? And if, let's say, she's not in the required age bracket for the people to make consent, we may involve the parents to ensure that they make, the girl makes the right decision. And also, maybe also to talk about abortion, there are some people that they can only deliver once. So after that, some people they have one child because they can only deliver one. It depends on the natural way, also how medical things also happen. So in that time, you also have to tell the girl that maybe this is the only child that you have. So once you abort, maybe you will not have a child. So we also have to explain to the girl the negative side of this, that the person understand. So concerning on the specific time or the best timeline for abortion, right, it is good if you do it early before time. Or I will not speak about a specific time because I don't also want to give false information, but what I know is that it is good if you do it maybe 4 weeks after conception, because once maybe it has gone far beyond maybe 7 months, that one you can't do it because you're endangering the life of the child and also the mother. Like you're not going to kill 2 people at the same time. So it's good to do it at the earlier stage. And maybe if you talk about maybe how you know maybe if someone has conceived, maybe after maybe having an intercourse. So that one, of course, as females always know the specific dates for their menstrual flow. So once maybe you don't see it, you have to think twice. It's not that maybe you have conceived. That will also come only after you had an intercourse. If you do it early before time. Or I will not speak about a specific time because I don't also want to give false information, but what I know is that it is good if you do it maybe 4 weeks after conception, because once maybe it has gone far beyond maybe 7 months, that one you can't do it because you're endangering the life of the child and also the mother. Like you're not going to kill 2 people at the same time. So it's good to do it at the earlier stage. And maybe if you talk about maybe how you know maybe if someone has conceived, maybe after maybe having an intercourse. So that one, of course, as females always know the specific dates for their menstrual flow. So once maybe you don't see it, you have to think twice. It's not that maybe you have conceived. That will also come only after you had an intercourse. You have to assess if you had it before. Of course, there are also some medical conditions that can also prevent menstruation. So once you see like maybe your days are spent maybe 2 months without going, then you have to come to plan assess if you are pregnant.
Thank you so much. I also thank you to each and every one of you for engaging in our discussions. And in our discussion, we realized that whether abortion, yes,
So, okay, according to the medical perspective, it is the mother. It is the mother. But it depends. Let's say if you are already a family, then maybe you may have to go and agree. But in many cases, it is the mother. And let's say, but if it is like a child, then the parents has to be involved with the mother.
thank you so much. At the end of the conversation, we realized that whether abortion is good or is bad is always subjective to the situation of the parent, the mother, or the person who has the most authority over the situation. And as we've already reviewed, the Constitution of Ghana gives us certain conditions to meet so that we can have a proper abortion. So at the end of the day, do we say abortion is good or bad? That's we've still not been able to answer, and I believe we will still not be able to answer. But one thing at least we have established is that that decision always lies with the parents or the mother or the guardians who will be in charge of the child. Thank you so much for a fruitful.
Maybe the last one. I feel like we have not come to an end, or maybe get the right decision whether abortion should be legalized or maybe to be seen like it's bad. The people in the comment section will help us to tell us whether where do they stand? Should it be legalized or should it be penalized? We really want to know your thoughts, and thank you for watching.
Thank you so much.
Bye bye.